Hi, I just wanted to review a couple little basic things. Uh, this is someone else, but most of my patients who are coming in for just some limited treatment on the bottom have some degree of crowding, like what you see down here on these bottom teeth. And sometimes looking at them from the front, they can look kind of something like this. And what I'll be doing when you come in is going across the teeth and polishing the teeth for a minute or so. And then what we use is something that looks like a very small Q-tip to rub one chemical onto the tooth surface. We blow dry that, and then we go ahead and usually place 2 braces at a time, and then if you need to, you can go rinse a couple more braces at a time. And so we just kind of rub the tooth, blow dry, place a couple braces on, and then we shine a blue light, and that makes the glue actually stick to your teeth. So the actual process of putting the braces on doesn't hurt at all. Pretty easy stuff. When you leave that day, it'll feel a little strange and awkward, but you'll get used to it pretty quickly. Sometimes the bite will feel a little bit strange, and just the way your lips fit up against them is what people will kind of notice. But it'll get easier in the coming days, and we'll show you a few tricks to be able to adapt to it all. The other thing that is going on too is that as we get the braces on and start straightening them out, most people's teeth are very kind of crooked and overlapping like this, and we've probably talked a little bit about basically doing some filing or reshaping of the teeth. And I'm going to show a little video here, and in this video it kind of shows that process here using a different process than what I use. It's almost like this little sandy file strip there, and as it's working, you'll see it all of a sudden start to like shave a little bit off the sides of these teeth. Like this one right there, you can kind of see it's just kind of readapting that. Now, I don't do this at the first visit. I do that once the braces have already been on and start to straighten these out. Okay, so if you can imagine starting again, looking back at that one, looking like this, and then a little time later, the teeth being a little bit straighter, and at this point I can go between the teeth and reshape them and make them look better. My best example of what this really looks like is when you look at these top teeth, this one tooth right here is kind of angling to the side a little ways. This one's angling a little bit to that because it's not really straight up and down, it's actually kind of on a diagonal slant. The edges are flat, but that's because they've just worn down through many, many years. So the braces go on, and this might look actually worse, but this is actually what the teeth look like about maybe a month or two later. The teeth are actually vertically positioned the way they're supposed to, but all of a sudden you can see where this gap has opened up between them. And I'm going to go back to that original photo. Again, you can kind of see how these two teeth are kind of overlapping and they're butted up against each other. And then as I start to align them and straighten them, you see these gaps appear. Now, what I then do is go between these two teeth and do a little bit of reshaping and filing. Okay, so we have this again space between those teeth, and so that day what I actually do is make a nice kind of more uniform space straight up and down between these two teeth. So going from these teeth overlapping to being better aligned, but having this little bit of a void where the gums will never grow back in and kind of fit in. If you can imagine, as a teenager, this would have actually worked out very nicely and the gums would still be filling in there. But we then reshape those teeth so that as next visit a couple weeks later, this looks pretty good here now. There's a difference in the size of the teeth overall, but it's that spot between the teeth that we're trying to get to look good. And so if you can kind of picture going from that to that, that's what that little bit of reshaping between the teeth basically allows us to do. All right. And then once we actually get the teeth all aligned, there's still work to kind of be done here, but once we get the teeth all aligned, what we'll typically do is place what we call a bonded retainer. And the bonded retainer looks something like this. We make a little wire that glues in behind these lower front teeth. It's something you can still brush around, you can still actually get in and even floss around it. It's a little bit more difficult and it's not quite as good a flossing job, but this is usually not an area where people will have gum disease or decay once the teeth are straightened out. So it kind of works out kind of evenly. But basically we put that wire in because for the rest of your life your teeth always have a tendency to want to move and shift. So by putting that in place, it kind of locks the teeth in their final position, and from the front you can't really ever see that that wire is there. Alright, thanks for listening.